Learn how to truly make a difference by mastering the art of promoting independence and dignity in every interaction. This course is focused on the key principles of promoting patient independence and preserving dignity, essential skills for nursing assistants and healthcare workers to provide compassionate and respectful care to patients. Promoting independence and dignity is at the core of patient-centered care. Nursing assistants, CNAs, and healthcare support workers are often in a position to help patients perform daily activities, but this assistance must always be provided in a way that respects the patient's autonomy and personal dignity. This course covers key strategies for maintaining patient independence, respecting personal choices, and empowering patients in their care. It also emphasizes practical methods to balance patient safety and comfort with respect for their rights. Understanding the importance of promoting independence and dignity. Promoting a patient's independence is a fundamental part of fostering self-esteem, autonomy, and dignity. When patients feel that they are in control of their decisions and their daily activities, they are more likely to experience emotional well-being and physical recovery. The benefits of promoting independence include enhanced self-worth. Encouraging patients to perform tasks on their own helps them feel valued. Improved physical health. Active participation in self-care activities supports better physical and cognitive function. Emotional well-being. Retaining control over one's care fosters a sense of empowerment and dignity. Reduced dependency. Helping patients retain as much autonomy as possible prevents long-term reliance on caregivers. For CNAs, promoting independence involves finding the balance between supporting patients and allowing them to engage in their own care routines as much as possible. It's about offering assistance when necessary, but not imposing help when the patient can do the task themselves. Respecting autonomy in patient care. Respecting a patient's autonomy means allowing them to make decisions about their care. Autonomy refers to the patient's right to choose their actions and decisions based on their personal values and beliefs. Key points to consider. Patient rights. Every patient has the right to make decisions about their own care, including the right to refuse treatments, medications, or procedures. CNAs should encourage patients to express their preferences and actively listen to their concerns. Encouraging informed decision-making. Patients should be given clear, concise, and accurate information to help them make informed decisions about their health. As a CNA, your role is to provide assistance with the practical aspects of care, but also to empower the patient to make their own choices. Respect for personal beliefs. Different cultures and individuals may have varying perspectives on care. CNAs should be sensitive to these differences and respect personal beliefs regarding treatment or preferences for care practices. Communication skills for empowering patients. Effective communication is central to promoting patient independence and dignity. The way CNAs communicate with patients can significantly influence how patients feel about their care and their role in the decision-making process. Key communication strategies include active listening. Listen to the patient without interrupting, ensuring they feel heard and valued. Use body language, like nodding, to show attentiveness and empathy. Clear and simple language. Use plain language when explaining tasks or treatments to patients. Avoid medical jargon unless the patient is familiar with it. Respectful communication. Address patients respectfully, using their preferred name or title. Encourage open-ended questions to invite the patient's opinions or preferences. Nonverbal communication. Be aware of your body language. Maintain eye contact and use a calm and respectful tone of voice. Pay attention to the patient's body language and nonverbal cues, which can often communicate their needs or discomfort. Supporting patients with activities of daily living, ADLs. Assisting with activities of daily living, ADLs, such as bathing, dressing, toileting, and feeding, can be an opportunity to promote a patient's independence. While it may be necessary to help patients with these activities, CNAs must focus on promoting the patient's autonomy within the care process. Involving patients in decision-making helps patients feel more in control of their care, which can positively impact their recovery and overall satisfaction with care. Ways to involve patients in decision-making. 1. Ask for preferences. Always ask the patient how they would like to be cared for, whether it's about their environment, treatment, or ADL preferences. 2. Offer choices. Provide options whenever possible. For example, offer different methods of bathing, shower versus bed bath, or meal options based on the patient's dietary restrictions. 3. Encourage participation. If a patient is able, encourage them to assist in their care, such as brushing their own teeth or choosing their clothes for the day. Building trust and rapport in patient care. Trust and rapport are essential for fostering a collaborative and empowering relationship between the patient and CNA. Building these qualities can enhance the patient's emotional well-being and encourage participation in their care. Key strategies for building trust and rapport. Consistency. Be consistent in your interactions with patients. Being dependable and following through on promises builds trust. Empathy. Show empathy by acknowledging the patient's feelings and offering support. For example, if a patient expresses frustration about their condition, offer comforting words and actively listen. Respecting boundaries. Always respect patient boundaries and preferences. If a patient is uncomfortable with a specific task, try to find an alternative or provide reassurance and support. Positive reinforcement. Offer praise and encouragement when patients take steps toward independence, such as dressing themselves or making decisions about their care. Addressing challenging situations while maintaining dignity. In healthcare settings, CNAs may encounter patients who are resistant to care, refuse assistance, or exhibit challenging behavior due to their condition. Handling difficult situations while preserving dignity. 1. Patient refusal. Respect the patient's decision to refuse care unless it poses a risk to their health. In such cases, explain the consequences of refusal and involve other healthcare professionals as needed. 2. Behavioral challenges. Patients with cognitive impairments or mental health conditions may be non-compliant or confused. Stay calm and use simple explanations to help them understand their care needs. 3. Maintaining privacy. Ensure privacy during all tasks, especially when dealing with personal care needs. Even when the patient refuses care, maintaining privacy reinforces dignity. CNA responsibilities in promoting independence and dignity. As a CNA, it's your responsibility to ensure that the care you provide always supports the patient's independence and dignity. This requires you to communicate effectively, respect the patient's choices, and adapt care routines to meet the patient's individual needs. Key CNA responsibilities include: 1. Advocating for patients. Speak up if a patient's preferences are not being considered by the healthcare team. Be an advocate for their right to participate in their own care decisions. 2. Accurate documentation. Document all patient preferences, refusals, and changes in condition accurately and promptly. 3. Continuous learning. Regularly participate in training and professional development opportunities to improve your communication and caregiving skills. By maintaining a focus on patient autonomy and dignity, CNAs help ensure patients receive respectful, compassionate, and individualized care.